In March 2020, COVID attacked Polish universities as unexpectedly as all other spheres of life. In just a couple of days, most rectors all over Poland decided to immediately suspend contact classes and switch to a remote mode. More than 100,000 academics and about 1 million students suddenly found themselves in a completely unfamiliar situation. We had no experience in dealing with a crisis of this kind and magnitude, having to take decisions on which the lives and health of our colleagues could very directly depend. On top of that, there was a growing mood of uncertainty, driven by all sorts of rumors and projections of the future. No one actually knew either how long it would last or what it would end up being, which measures would over time prove justified, which exaggerated or premature, and which utterly insufficient. The period of the first few months passed with government restrictions being tightened and lifted, but in late summer of 2020, at the dawn of the new academic year, it became clear that pandemic and the associated emergency operating rules would last much longer than anyone had expected before. At the same time, the government left universities free to decide how to function, which meant that each rector had to reckon with the fact that all further mistakes in a situation of an extreme crisis and risk would be their own, and that they will have to take their decisions on a daily basis without much outside support or assistance. Decisions of the kind that few rectors felt prepared and confident to take. For these reasons, in the fall of 2020, the idea was born to set up a special purpose network under the Polish Conference of Rectors umbrella to exchange information, monitor situation at the universities all over the country, and consult on key steps to be taken next. At the same time, the network was to identify legal, financial, and organizational problems, the solution of which required changes in the law or another sort of external state intervention. 16 regional coordinators, most of them from among rectors or chancellors, were appointed and formed a team led by a national coordinator. And the group began their regular weekly meetings. They turned out to last throughout the whole pandemic and utterly unexpectedly also beyond it. With the help of the Gdańsk University of Technology, a simple application was promptly made up to enable efficient collection of exact data on the number of infections among employees, students and PhD candidates, on the situation in dormitories, and the specific organizational solutions adopted across Poland, as well as on the problems reported as reaching beyond the decision-making capacity of individual universities. Very quickly, the network established a close cooperation with the Ministry of Science, whose representatives attended coordinators' meetings on a regular basis. Their role was not only to consult and discuss with us the current policies, but to pass information back and forth. They relayed data and conclusions from our weekly reports to the level of the government crisis committees and informed back us, coordinators, about the intentions and concerns discussed in government circles. The efficient and rapid circulation of reliable and complete information became the first and one of the most important achievements of our network. The proposal to entrust me with the role of the national coordinator came from the main executive board of the KRASP, Polish Conference of Rectors. I suppose that the main reason was my prior experience from the years long before I became the vice rector of the University of Silesia here in Katowice, when I had served as a senior governmental official responsible, among other things, for the crisis management system in Silesia, one of the most difficult regions in Poland in this regard. At that time, I had to organize, among other things, the crisis management operations after the biggest building catastrophe in the Polish history, the collapse of an exhibition hall during a huge bird fairs. As a vice rector of my university, at the outset of the pandemic, I co-developed a system of internal safety levels as a remedy for rather chaotic and inconsistent actions taken in the first stage of our response. The system was quite well received. Several universities adopted similar solutions after us, and we continued to use it substantially unchanged throughout the subsequent years of the COVID crisis. My responsibilities as the CRASP national coordinator is to lead the team of regional coordinators, design and oversee the nationwide data collection system, organize and chair weekly coordinators meetings, determine their agenda, and stay in daily touch with the Ministry of Science. I must admit that being an extremely challenging experience, it was also a once-in-a-lifetime opportunity to contribute quite uniquely to the common good, and at the same time to learn so much and so quickly from such extraordinary circumstances, putting together all intellectual and organizational resources of the Polish academic world. And I'm really, really grateful for having had a chance to do that. Our team of coordinators didn't take any formal decisions, since we weren't an official body with legal authority over individual universities. Our discussions led to consensus-based arrangements that resulted in informing about our conclusions and recommending academic policy-making solutions. But in terms of real decision-making powers, each rector remained fully independent and solely responsible for their institution. What seems to me the most important aspect of our network is that facing the most serious crisis and threat in years, we managed to provide basis for a genuine evidence-based policy to be pursued by academic authorities. It doesn't mean that all the decisions taken in Poland were actually wise or even adequate, but most of them were, partially due to the accurate data, updated information, and expert assistance we provided as a basis to define rational and considerate actions by those decision makers who wanted to take them into account. Part of our team were also some vice rectors of medical universities, including renowned specialists in epidemiology, so we had also purely expert input from their side. Additionally, our network included elected national representatives of students and PhD candidates. It let us create conditions for exchanging expertise on the one hand and the articulation of expectations and viewpoints of key stakeholders on the other. I'm convinced that due to our efforts, Polish academic community became much better prepared to respond to the successive stages of the pandemic, with decisions based on robust grounds, most accurate data, and thorough rational deliberations. As one could expect, especially from institutions dedicated to creating and transferring scientific knowledge and devoted to building rational approaches to examining and improving reality. The period of the pandemic brought to our universities not only the challenge to responsibly adjust our own functioning to those extraordinary and rapidly changing situations, but also to support the external society with the resources and expertise we were expected to share. Thanks to our network, it was much easier to produce, for example, guidelines for student engagement as volunteers in public endeavors against the pandemic. They could learn by practicing in the most demanding situations imaginable. It required, however, brand new and much more flexible attitudes from their supervisors and academic authorities. Our network helped to facilitate responsible programs of such volunteering on a national scale, balancing relevant needs and considerations. One of the most remarkable outcomes of our work was the role we managed to play in organizing and promoting vaccination among academic communities. The speed in which the overwhelming majority of our colleagues got vaccinated was really impressive. In many ways, universities became role models for the rest of the Polish society. Moreover, campaigns promoting vaccination were elicited helped to rebuild confidence in science as a key element of distinctive identity of those belonging to academia, be it students, researchers, or administrative staff. The best proof of the significance and value of the COVID coordinators network is probably the fact that the same structure was used to respond to the next crisis that came immediately after the COVID pandemics. After the Russian invasion of Ukraine in February 2022, a huge wave of refugees appeared in Poland practically overnight. The KRASP Executive Board decided that the still existing network of COVID regional coordinators can be easily adapted to immediately tackle also that new challenge. The structure of the network, its already developed routines, got promptly redirected towards working out best ways to respond to the refugee crisis and providing help and assistance to the Ukrainian higher education sector.